The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. I'm Amy Wellard with the Wildwood Lifestyle Center and Hospital, and today we're going to be talking about vibrant womanhood, what we were created for. And with me today is Dr. Shirley Fernandez. Welcome to the show.
Thank you. Privileged to be here.
Today we're going to be talking about how you can have the optimal health for yourself and for your baby in the preconception months and in the prenatal months, those months when you are actually pregnant. So, Dr. Shirley, tell us, please, when is the best time to start thinking about becoming healthy if we want to have a baby?
Okay. It is really fun, when people come and ask, the same question you ask me, how soon am I supposed to be prepared for a pregnancy, so that I can get the optimum, the best baby I could have. The thing is, at least 6 months before you conceive, okay? Or if I would put it in even more to practical, when you are now thinking to get married, or even looking at another guy, okay? A guy's looking at you, of course, and then you see his way too, and you're going to get what they call serious. You should start thinking about how healthy your body is, and 6 months, at least 6 months before conception is the best time to think to get yourself and work on it healthy.
Mm-hmm. So would there be any reason to go and get a checkup with our physician before we think about conception?
Yes, it is a good idea. Even before conception you go, not when you're already pregnant, but even before you get pregnant.
And what particularly would the physician be looking for?
Oh, it would help the physician a lot if you would plot your menstrual pattern at least 2 months and you watch how your menstrual pattern goes from day to day, what activities affect your, like PMS or dysmenorrhea or things like that, so that you can help already your doctor how he's going to manage you and bring you to have this pregnancy well taken care of.
And so if you're not already experiencing regular menstrual cycles, as we were talking about in our fertility program, perhaps our physician would recommend, or we can recommend on this program today, what people can be doing, what women can be doing to get more regular so they can improve their chances of conception.
Yes. Again, I hope nobody's going to get sick. That's all she knows. But it is really important that even if you're already healthy, so some people are healthy, they're not working on it, but they seem to be healthy. Wouldn't it be even much better if this person would really take care of himself, take into serious consideration the 8 natural laws, then being really mind, body, and soul healthy before you get pregnant? Absolutely. And if then you're doing everything, there are certain herbs that you can take to prepare you to have your brain and your body, your uterus, your ovaries, and everything ready for conception.
And you mentioned in our previous program, Dong Quai has been very useful in your practice.
Very useful.
For regulating the cycle.
Vitex for ovulation.
Vitex, which is otherwise chasteberry.
Yes.
Okay. Well, what other precautions should a lady take before she conceives? For example, vaccinations. That's quite a controversial topic.
Yeah, but many of us, when we already are, of childbearing age, we probably in one way or another, when we were younger, we were given our vaccines already. If not given our vaccines, then, well, you would want to be covered, at least. So it would not be bad if moms with little girls, you grandmas to be, come and bring your girls if there's chicken pox somewhere. You have a chicken pox party, mumps party, and a measles party, German measles party. So they don't have to, you know,
Get the vaccination.
Get the vaccinations, because if they're well taken care, they're relatively healthy. When they catch the problem, I mean, you have this chicken pox party, they get the immunity, you know,
naturally from being exposed to the virus.
From being exposed. But parents don't want to take, you know, I don't want my kid sick, period. Well, then you just have to be careful not to get sick around the time you're pregnant. But you have to check for all these immunities, for diseases that can come and cause abnormalities such as German measles. That is very important because it causes real documented problems if the mother gets it within the first 3 months of pregnancy. Any transmitted disease might affect the pregnancy. And check your teeth, because you might have tooth decay or cavities that hurt when you're pregnant. It's hard to manage, but you know, these things.
And you want to avoid x-rays.
Yes.
So if you need dental work, best to get the x-rays done
before. Yes, and ultrasounds to check, and blood tests to check whether you're okay.
Okay, and so what about folic acid? That's very topical.
Oh, yes, that's we cannot say more than we can say. It is important. You don't want to have a baby with no brain, you know? A baby that comes out with only a face but no brain. And or a baby with spinal cord problems. Folic acid deficiency causes nervous system problems from the brain down to the spinal cord. It's been proven. So you want to be sure you have folic acid levels normal. Take supplements before you even get pregnant.
Okay, and folic acid is found in our green leafy vegetables, beans, and if you're on a good plant-based diet, there should be
enough.
There should be no danger of deficiency. So that's very encouraging. So what about vitamin D levels? This is now in the popular press that women really do need to take supplementation of vitamin D because we're so deficient. It's a pandemic, the deficiency. So we should get a blood test to check?
Yeah, that would be nice, because then you know where you stand, and then you can have what they call a control to see how much you should be taking, how rigorous you should be out in the sunshine, and or how much vitamin D you should be taking, because there is this controversy about how much you take. Well, you never get an overdose in the sunshine.
Really?
So, yes, you never get overdose from sunshine exposure, except of course you have to take care, because you can develop skin problems afterwards. But as to the vitamin supplement, as to the vitamin D with regards to the sunshine, you cannot get an overdose of sunshine. So then it's much better to be out in the sun. And besides, you'll feel good about yourself. You'll be healthy. Your sugar will be controlled. Your your cholesterol will be controlled. And a lot of stuff, you'll be happier besides. Your boyfriend would be nice, would enjoy being with you.
Going to make a happier pregnancy, makes a happier baby.
Yes.
But if we have to take supplements, what are they recommending we should take?
Okay, there are two types of vitamin Ds. Okay, there's one vitamin, the vitamin D2. Vitamin D2 is taken from plant. Okay, it's a plant-sourced vitamin D. And there's vitamin D3, which is animal-sourced vitamin D. Well, it can come from different sources, but the one that I would recommend is the vitamin D that comes from sheep's wool or sheep's lanolin. That's what we would regularly give, you know. So those are the two types of vitamin D, and there are doses out there. There are studies that have proven that even as high as 10,000 international units is relatively safe for supplementation. But you have to take that for not longer than 2 months and have your level checked again. You know, 10,000, 5,000. Maybe if you're afraid of 10,000, just go down to 10,000. Just go down to 5,000.
Okay. Now, I've heard that some babies, certainly in certain countries of the world, they're born with very low vitamin D levels, and this can actually cause fracturing of the baby's bones.
Yes, multiple fractures, in fact. Well, you can easily check fractures, you know. You bring them to the hospital and they put in and check this. But that's not the problem. The fractures are not the problem. Actually, it's deeper than that. Mothers go to prison because they're what do you call this? They're guilty. They're thought to be guilty of maltreating their kids, you know, babies with multiple fractures. The mom must have rolled the baby down the stairs and the baby had a lot of broken bones, but really it's not that. It's the mother was just holding the baby in her arms and maybe just lulling the baby to sleep, and the baby breaks bones because the bones are so, what they call this, brittle or friable, you know, that they easily just fracture because of the lack of vitamin D. The mother was deficient in vitamin D, and of course the baby would be deficient in vitamin D.
Right. And vitamin D is necessary for the binding of the calcium to keep the bones strong.
Yes.
Right? So would you recommend a calcium supplement as well?
Yes. It is like this. When you do a vitamin D, a calcium should come along.
Okay, the two go together.
Yes, the two. That's why you have a lot of supplementations that say calcium, magnesium, vitamin D, because that's for bone strength. You know, magnesium, calcium. But you get your magnesium from your grain, from your vegetables, green leafy vegetables. You get your calcium there too. But some would say still take the calcium.
Okay. Now, a lot of ladies also suffer from anemia during pregnancy, low iron. So perhaps there's some foods that contain iron that would be.
Oh, there are black strap molasses.
Delicious.
Enjoyable iron source. I lick it like this off a spoon. I don't know about others because it's a little bit bitter, but it's good. I can put it in my beverage in the morning. 3 tablespoons a day would be really good.
Now, it has to be the black strap, not the other kind?
Yeah, because the black strap is the one with not only iron, but the other minerals that come along with it, plus fiber.
Okay, now during pregnancy, often we gain huge amounts of weight. Let's move on to this subject.
Okay.
Weight gain in pregnancy. The average recommended is 25 to 35 pounds, I believe. But if you're already overweight when you enter pregnancy, would you encourage people to eat a little bit less? I mean, we're meant to have an extra 300 to 500 calories a day, I think. But if you're overweight, would you say don't take so many calories and you could lose the weight during the pregnancy?
Yeah.
Or
yes,
that still would be healthy for the lady?
Not so much. Really, the thing is, you should be spending more of the calories that your body had stored. You know, you hit for a certain amount of weight still. 25 to 35 is for somebody with normal weight to start with, but if you're overweight, it's 15 to 25, so it's about 10 pounds lesser than the normal weight gain. And you could probably just a little bit diminish on your food, but you see, there are 2 of you, that's why you cannot sacrifice. Maybe the safer way would be for you to have regular exercise and burn down whatever extra you have, rather than trying to cut down on what the stores you already have. Okay. You and your baby would be suffering.
So exercise is the key.
This is really very important.
And that's for everybody, not just those of us that want to lose a few pounds. Okay, so what kind of exercise?
Well, studies have proven that if you were exercising, let's say, swimming, climbing the mountain, on foot, okay, not rock climbing, but whatever exercise activity the pre-pregnant woman was, she can bring to pregnancy still. So if she was mountain climbing instead of rock climbing, I mean, if she was mountain climbing, she can still, as long as the tummy doesn't get in the way. So even when she's still small, when the tummy's not really big and her back doesn't change yet, the posture doesn't change yet, she can still continue with the exercises. It's not, pregnancy is not a disease. It's just, oh, I'm sick, I'm pregnant. No, it's not. Pregnancy is a normal physiological thing. It's not supposed to keep you from doing a lot of stuff that you used to do before you were pregnant.
And it's a beautiful time in your life.
Exactly.
Isn't it? It's a time when we blossom in spite of all the
I enjoyed my pregnancy, really, I did. Even if there were some problems, I enjoyed it.
Now, something else we need to mention is, obviously we're avoiding a lot of the dangerous chemical hazards, but also the intake of drugs like nicotine, alcohol, caffeine. Could you give us a word about those, because they're so popularly used?
Oh yeah, I've seen babies affected by alcohol. You call that the fetal alcohol syndrome. The babies have a certain feature. Oh, when the baby comes out, you just know it is, even if the mother didn't tell you anything. The face of the baby, you would know, the structure, you know that the mother was drinking. There are, alcohol can cause fetal alcohol syndrome. So you don't want to have an abnormal baby, do you? You don't. So then refrain from doing alcohol. For nicotine and for caffeine from cigarette smoking and or drinking coffee, both of them cause small for gestational age or low birth weight, okay? Low birth weight infants, if they ever come to term. If they don't, you can have a premature delivery. So you have premature babies and or babies that may come to term, but they're tiny, small for gestational age. And these babies have risk factors. You know, there are risks to this kind of babies. They have a hard time coping, failure to thrive, some things like that.
So we really encourage you, some of our viewers there, that maybe you're facing issues with nicotine and alcohol, that if you are pregnant, the Lord will give the grace to refrain from those things so you can give your baby the best start possible. Let's talk about some of the symptoms that you typically face when you first become pregnant. Some people don't know they're pregnant until several months later, and some of us know right away. We've got nausea, vomiting, or cravings. What was it for you when you conceived your baby?
Oh, it's because I was not even thinking about getting pregnant. As I said, I really was working on it. But I think the first thing that alarmed me was I had a voracious appetite. Really? I just ate and ate and ate and ate. And then when I noticed that my menses hadn't come on schedule, you know, sometimes it has something to do with the mind also. You just can't explain everything. But when I knew I had my positive pregnancy test, a few days after, I started having nausea, and vomiting.
And of course, being a doctor, you knew all the symptoms that you should be having. So.
I knew it was so. But the funny thing is, even if you're a doctor, you know what you're supposed to do, and you never thought it would happen to you, but it will. I'm human. That's good.
So what did you do for your nausea? What can we recommend for nausea, vomiting, morning sickness, or all-day sickness? That's actually what I had. It wasn't the morning. It was just the whole day.
Okay. Usually, they call it the morning sickness, right? Because the majority of women have it early in the morning. It's because we went through the whole night of, you know, not eating, fasting, so that the nutrients in our body are low, you know. So then because of this change of the level of the hormones and this low nutrients, we start to have this nausea and vomiting. It's a hormonal change that does it.
And I know some books will recommend to snack or have crackers by your bed, so when you wake up in the morning before you move, which can often
even before you move, yes,
you just eat some crackers, and snacking through the day. Now this is an important point. Would you recommend that when you're suffering from nausea, you snack all through the day?
I would rather that you don't, you know, but if you got to do what you got to do, she can't eat. She throws up everything. Then she's not getting any nourishment. But, well, you don't want to go to the hospital. You just have to do what you got to do and give her these little things that she may just be able to assimilate. Because the bigger the stuff you get, the more it comes out. So, you know, so
small and often rather than large.
Yes, rather than none, you know.
Right, rather than none. And if you can avoid doing the constant snacking, that's even better for your digestion.
Yes, if you could just do it, yes.
Right. So what else can we do for the nausea? I know that ice chips can help.
Yes. Now, I usually tell them just plain fruit, real fruit, fresh fruit that you, you squeeze, yeah? So then it doesn't have extra sugar. Fresh fruit squeezed, you put them in little tiny bit of juice cubes, you know.
Yes.
Like
in the tray?
In the
and
tray.
Freeze it?
Yes.
Okay, so you get an icy juice.
Yeah, so then you have your glucose and your coldness on your throat at the same time.
Sounds nice. And I've heard that ginger's good for nausea, and catnip
Yes,
tea,
it's good.
and sage tea even can actually help quell the nausea as well.
The ginger is what I really appreciate
Recommend.
because I tried it on myself and it did work.
Now, something else that is very common is constipation, which leads to other complications that can be very painful, like hemorrhoids.
Yes.
What can we do about that?
You cannot do anything about it. I mean, hormonally, you know, your progesterone is working on it, you know, and it's making your intestines just move sluggishly like that. And so the water and the fluid is absorbed back. And so you do really have hard stools. But if you eat a lot of whole grains, a lot of vegetables, green leafy vegetables, you have fiber, a lot of fiber that makes your stool go down faster. And exercising would do it too.
Yes, and one lady even told me she ate 7 prunes every morning, and that helped
prune
her.
juice, yes, prune juice, yes, good.
Now, headaches. Let's talk about headaches. What causes headaches in pregnancy, especially early pregnancy?
It's the same. It's still this changing in hormones, you know. And well, it will come and go. Sometimes it's a long time there. You could stay home and in a quiet room, pull down your curtains, your shades, so that you're in a cool, quiet room, and you could put a cold, what they call this,
A cold press.
cold compress on your forehead.
And that's preferable to taking some kind of
Yes,
medication.
no,
to give the
I'd
baby.
rather just not take anything, unless if it's really bad, then you would. But these natural things that you do will usually help.
Now, most of these symptoms are the first trimester, right, when the body's really going into major adjustment. And then as we get to the second trimester, sometimes women experience itching, excessive itching on the abdomen or on the breasts from the stretching of the skin. What can be done about that? Because some people even complain, you know, they can't sleep. It's so itchy.
It wakes you up, and you wake up itching, you know. And it's not only who's disturbed, but your husband will be disturbed too. You know, and so what you could do, what I did it's simple, you know. You can go buy shea butter or cocoa butter or whatever butter lotions they have out there, but you're not really sure whether these things have, you know, this other chemicals. You would want to refrain from putting any chemicals in your body, because you would really put it this way. It's itchy, so the thing is, when it's itchy, you add more, and so you really want to work on it. So you work on it, and you might put all the extra chemicals on your body. But if tested and proven, when you're in the shower, when you just finished your shower, and there's little water left on your body, these droplets of water, you can get the vegetarian mineral oil, you know.
Okay.
And then rub it around the areas where you have the most itching. Because if it were wet and then you rub this thing on, especially if you had a warm shower, it absorbs into your body. It absorbs into your skin, and you would have a more supple and
get
more,
relief.
Yes, relief and more supple and moist skin.
Now, urinary tract infections is another thing that's very common in the early stages of pregnancy. And this can be very painful.
Yeah.
And debilitating. So what can we do for that? We don't want to take medications as much as possible.
No, it's scary, because many women, especially those with abnormal menstrual pattern, they're not regular, will come to you, and that's the first manifestation of their pregnancy, urinary tract infection. It's because as your uterus becomes bigger, it impinges on the bladder and changes the bladder urethra angle, so that you don't empty your bladder completely. If you don't empty your bladder completely, there's some urine there that can become a culture media for bacteria. And so what you should do is to increase your fluid intake and make a conscious effort to really, as much as possible, void everything, okay? And if you're not sure, especially those with abnormal menses, if you have urinary tract infection or difficulty of urination, you have to tell your doctor that, "Doc, I have an irregular menstrual pattern. I'm just not sure whether I'm pregnant." So then they go ahead and check whether you're pregnant or not, because many abnormalities came from medications for urinary tract infections because the pregnant woman didn't know that she was pregnant.
Oh, thank you. That's very good advice.
Yeah.
Let's talk about rest and relaxation. I remember in my first trimester, I was just completely fatigued for the whole 3 months. I don't know if that's common, but
it's hard. It's hard. With all the nausea and vomiting, you're stressed. You're really stressed.
Right. So is it basically just lie down every time you feel like it?
Oh no, you will be surprised that when it's proven, you know, when women stay home and in the room alone, all these signs and symptoms escalate. Bring them to the mall, bring them to the park, bring them for a walk in nature, and you'll be surprised they will be like normal.
Okay.
Because I felt so bad in the house, you know. But when they brought me out, no smelled bad, no headaches, no. It's change of environment usually helps.
Very important.
It does help, yeah.
And you know, that's an important point, how we think and how our environment affects how we think, but also how we think is going to impact our baby.
Of course.
The Bible actually says, as the woman, so the daughter, in Ezekiel 16:44, I think it is. And so what it's saying is, as a man thinks in his heart, so the baby will be. And so we don't want to be transmitting negative thoughts, negative emotions to the baby and make them come out a negative child. So, you know, it really is possible to control your thoughts and feelings, even when you really feel your worst.
Yeah, because your chemical composition or your body's chemicals go to your baby too. So if you're really not, your body is not normal, not really good, you don't have this milieu, your internal milieu well balanced. This goes to your baby. Have you ever, mothers who are fretful while they're pregnant, when the baby comes and screams, they said, this mother must have been fretful. It's just that you see it over and over. A baby that cries a lot, it's because the mom cried a lot. A baby, you know, the baby drinks and grumbles like this, the mom was grumbling when she was pregnant.
Fascinating. Now, I would like to mention a word about miscarriage. This is so popular, so prevalent, I should say, and I myself did have a miscarriage at 8 weeks. It's a very painful experience. Can you tell us a little bit about what to do if a pregnant lady is experiencing premature contractions?
As much as possible, she should rest. And then if it doesn't disappear in, let's say, 20, 30 minutes, she should seek help, because especially if the baby is a wanted baby, she might have really, you know, she might abort.
And of course, we don't want that to happen. That would be tragic after going through the pregnancy. And so what can the lady do to prevent the miscarriage?
Rest and chamomile tea.
Chamomile tea. That will actually help relax the uterus so that the baby will no longer be expelled.
Yep.
Wonderful. Thank you so much for the wonderful health tips. What would be your final word to ladies that are pregnant?
Oh, never fret of your pregnancy. Love your pregnancy. Especially love your baby. It is a gift to you from God.
Healthy baby, healthy mommy. Healthy mommy, healthy baby. Remember, Jesus said, I have protected you when you were in the womb, and I have covered you